The armamentarium for this assignment includes your surgical mask, safety goggles, face shield, gown, and nitrile gloves. For the patient, you will need their bib, bibbies, and patient goggles. In addition, you will need your Marquis probe, neighbor's probe if needed, dental mirror, floss, tray with liner, HVE, saliva ejector, air water syringe, water bottle with water, and the master switch turned on. The Marquis probe is an assessment tool that is used subjectively. It is double-ended, unpaired instrument. It has a flexible, simple shank and is circular in cross-section. It has a blunt and rod-shaped tip with no cutting edges. It is calibrated in millimeter markings and is used to determine the health of the periodontium. Measure sulcus depths, clinical attachment level, the width of attachment, assesses for bleeding, measures extraoral and intraoral lesions, and the longitudinal response of periodontal treatment. In the probing self-assessment assignment, we were asked to probe teeth number 8, 14, 24, and 30. Before probing a patient's mouth, it is important to ask them if they have a history of any periodontal treatment or if they have any concerns with their gum tissue. It is important to use proper patient and operator positions as well as the proper modified pen grasp. Use of the dental mirror and fulcrum. This is done with the dominant hand by placing the thumb and index finger across from each other. The pad of the middle finger should lightly rest on the shank. The index, middle, and ring fingers are kept in contact. A secure fulcrum should be established and the dental mirror should be placed correctly as needed. The proper use of the Marquis probe involves gently inserting the probe tip beneath the gingival margin to the base of the sulcus or pocket. It is important to keep the probe beneath the gingival margin with each 1 millimeter walking step and for the tip to stay in contact with the root surface. Wrist or digital activation may be used. The side of the tip should stay against the tooth and the orientation of the probe working end must stay in alignment with the root surface. You should tilt the probe slightly and extend the tip beneath the contact area to assess the interproximal area or hole. The deepest reading per area should be recorded and the measurement should be rounded up to the higher hole number. You should assess and record any recession and chart this in EagleSoft under MGL. During the probing process, you should check for any bleeding or separation after each quadrant. After completing the probing, mobility can be checked. Using the end of the cotton tooth pliers and the end of the mouth mirror, you can rock the tooth. Using the neighbor's probe, you can assess any furcations and then evaluate open contacts or areas of food impaction with dental floss. To measure the attached gingiva, you will subtract the probe depth from the gingival margin to the mucogingival line. Checking frenum attachments assesses and determines if there is an abnormal muscle pull on the gingiva and or if the patient has a short frenum. The neighbor's probe is used to assess furcation. Class 1 furcation is detecting curvature of the concavity between the roots with the probe tip but is unable to enter the space. Class 2 is when the probe penetrates into the furcation but does not completely pass through to the other side. Class 3 is when the probe passes completely through the furcation but is not clinically visible. Class 4 is when the probe passes completely through the furcation and entrance to the furcation is clinically visible because of gingival recession. Class 3 and 4 can be seen radiographically.